Understanding fraud, waste, and abuse, often called FWA, is everyone's responsibility in healthcare. It's more than just a billing issue. FWA drives up costs for patients, damages trust, and can put our organization and individual staff at legal risk. In this video, we'll focus on Part 1, what fraud, waste, and abuse actually are and how to tell them apart. Let's start with fraud. Fraud is knowingly and intentionally deceiving to get an unauthorized benefit. The key words are knowingly and intentionally. That means the person understands what they're doing is wrong and does it anyway, usually to get money or some other benefit they're not entitled to. Here's an example of fraud: billing for an appointment that never happened. Imagine a staff member creates a fake patient visit in the system and submits a bill to insurance for that visit. No patient was seen, no service was provided, but money is requested anyway. That is intentional deception for financial gain, and it is fraud. Next is waste. Waste is the overuse or misuse of resources that leads to unnecessary cost. It usually does not involve criminal intent. In other words, the person might not be trying to break the law, but their decisions still cause avoidable expenses for patients, insurers, or the organization. For example, ordering excessive, duplicate medical supplies that aren't needed, then letting them expire and throwing them away. No one is secretly stealing anything, but the overordering leads directly to wasted money and resources. That's waste. Abuse is different. Abuse includes practices that are inconsistent with sound medical or business practices and that directly or indirectly result in unnecessary costs. Abuse might not be as clearly intentional as fraud, but the behavior still violates accepted standards and causes financial harm. One common example of abuse is upcoding. That means charging for a more expensive service than what was actually provided. For instance, a 15-minute routine follow-up visit is coded and billed as a 45-minute comprehensive visit. The service level is exaggerated to get a higher reimbursement. That's abuse. Let's compare the three. Fraud requires intent. Someone knowingly lies or deceives for an unauthorized benefit. Waste involves poor use or overuse of resources, even when no one is trying to commit a crime. Abuse includes practices that break sound medical or business standards and still drive up costs, even if the intent is less obvious. All three harm patients, payers, and the organization. Understanding FWA matters because the consequences are serious. Legally, fraud and certain types of abuse can lead to fines, repayment demands, exclusion from federal programs, and even criminal charges. Financially, FWA increases costs for patients and the healthcare system. Ethically, it undermines trust, damages our reputation, and conflicts with our duty to put patients first. Now that you understand what fraud, waste, and abuse are, you're ready for the next steps. In the upcoming parts of this training, we'll walk through key rules to follow, everyday do's and don'ts, real-world scenarios, and exactly how to report concerns. Remember, recognizing FWA is the first step toward preventing it.